Hello everybody, this is Carlos from Army of Nurses and welcome to another video. In today's video we're going to be discussing how to become a nurse in Canada. Some general information about nursing in Canada. It's provincially regulated, which means that every province has a regulatory body that they issue licenses to applicants once the entry to practice competencies they have been met. The exam itself to get your license is a national exam. It's administered to every province, and which means that once you pass your exam in one province and you get your license in one province and you wish to move to another one, all you need to do is just apply for the license of the province that you're moving to without the need to rewrite the national exam. Some of the provinces like British Columbia, Ontario, Nova Scotia, they have a single regulatory body for RNs and RPNs. For some of the other provinces, they might have separate regulatory bodies for RNs, RPNs, or NPs. So please double check on that. The nursing licenses, once you get one, it needs to be renewed every year. You have to pay a fee for it. And if you're a nurse back home trying to come to Canada to become a nurse, please keep in mind that some of the credits or courses that you might have taken back home might not directly translate into some of the prerequisites or requirements that we have here in Canada. If you are planning to do nursing in Canada, please plan ahead of time because the application process can be lengthy and can be costly at the same time. And also ensure that you have a police check or a background check because you are going to be working with vulnerable populations, and a lot of schools, they require this to ensure that there's no criminal records behind that. That being said, there's three types of nursing in licenses in Canada. In this video, we're going to focus on the registered practical nurses, the RPNs. Okay. So in a nutshell, the difference between the RNs and the RPN when it comes to scope of practice, both of them, they study from the same body of knowledge. The RNs, they study a little bit longer from it. But the RPNs, their mandate is to be able to look after patients with a predictable outcome in a stable manner. The RNs are able to look after patients with a predictable or unpredictable outcome who are stable or could potentially deteriorate. Okay, so that's just in a nutshell. So if you decide to go for the RPN option, then the admission to the RPN programs, usually you require a high school diploma, some courses that can be on the university or college level, grade 12 English, math, and your life sciences and your physical sciences. Certain colleges, they have a requirement for an aptitude test, and this is just to ensure that you do have the right personality and attitude to be a nurse. Remember, you're going to be looking after patients who are very sick, families who are very devastated, and a lot of them, they're in the most vulnerable stage in their life when they meet the healthcare team. So a lot of the colleges, they want to make sure that you are the right person for the right job. Okay. The grade point average, it may vary between schools. On average, you are required around a B as a minimum to be able to be admitted into these programs. Now, once you're admitted, then you're required to hold a CPR certificate. Please ensure that this is at the healthcare provider level. The police check that we talked about earlier, vaccination records, and mask fitting tests, especially amidst the COVID-19 pandemic that we're all in right now. You have to get fitted for your N95 mask in case you have to look after a patient who is potentially infectious and in under isolation. The clinical preparedness checklist is just ensures that all the boxes are ticked and that none of the items are missed out so that your clinical doesn't get pushed back or you could potentially be compromised of doing clinical altogether. Now, the length of the program for the RPNs, usually 2 years to complete. Some schools, they actually might offer an accelerated option, which is you do a semester extra, so you don't have the summer off, you go through the whole summer, but you graduate sooner. The delivery methods usually is in class for all the theory. Now with COVID, we have created a lot of virtual classrooms, Zoom meetings, and class is delivered in a virtual setting as well. Simulations, a lot of the programs, they will require you to run some simulations so that before you transfer your skills that you're learning in the classroom, you practice on a mannequin in a controlled environment to ensure that things are safe. And then, of course, the clinical practicum, which is where you actually go to an institution, to a hospital, rehab, long-term care, to actually look after patients and practice everything under the supervision of a clinical instructor. Now, some of the courses that you will be taking include some A&P, nursing theory, pharmacology, some professional practice and development courses, health assessment, which you might or might not be required to perform an OSCE, which is a return demonstration for your health assessment, and the actual practicum component. So there's the theory part and there's the practicum part. A lot of the schools, the practicum part is a pass or fail. Okay. Now, once you finish the program, you will be granted with a college diploma. With the college diploma, you will be entitled to write the Canadian Registered Practical Nurse exam, the CRPNE. Okay, and this exam, it's in some provinces, in Ontario, for example, the province where I reside, you do have 3 tries. So, which means that if you don't pass the exam by 3 tries, you need to contact the college of nurses or the regulatory body, and it usually becomes a little bit challenging to have them allow you to write one more time, and sometimes they don't. So, best thing is try to always pass it on the first try. There's a lot of practice courses that help you prepare for this exam, but they cost supplemental, they have supplemental cost on top of that. So some of the tuition fees, and I'm basing this on a full-time schedule for Ontario schools mainly, and I put these numbers on the higher end of the spectrum, so there might be a range variance, but for domestic students, so if you're a Canadian citizen or you're a permanent resident in Canada, for a full-time schedule, you are aiming about $4,000 to about $4,600. If you're an international student, that cost goes up exponentially. So you are looking about $16,000 to almost $17,000, and this is including I'm including in this price tuition, I'm including books and stuff. So it might be higher because if you're an international student, you have to start renting and food and everything. It does add up, and all the different fees that schools have. So just a rough estimate of how much you are looking at spending. Now, what are some of the practice settings that you will be looking at as a RPN? So you will be working in hospitals, you will be working in communities, in private clinics. In hospitals, now RPNs are allowed to work in emergency rooms. You can work in the fast track area, in the intermediate or observation area. Some of the RPNs, they work in ORs, OR assistants, medical surgical units, all the different specialties, nephrology, cardiology, you name it, rehabilitation, mental health, community, long-term care homes, nursing homes, schools, assisted living, and of course private clinics for that. Now the hourly salary, I pulled this up from Pay Scale in August of this year, 2020. And the nationwide hourly average for RPNs about $19.77 to about $29.77 per hour. Now there's a big range in the salary nationwide, mainly and in general, mainly because it depends on your employer, depends on the province that you work in, depends on your years of experience that you have, and it depends on also certifications that you might hold on top of your registration exam. In Ontario, for example, as per 2020, the salary range for RPNs range from $19.86 in some places to about $30.21 in some hospitals. So again, when you look for a job posting, you will be able to see the your salary in there. Now, translating that into an annual salary based on 1,950 hours per year, which is a standard full-time, no extra overtime included in here, so this is just plain straight time. So the nationwide average, you're looking between $38,500 to about $58,000 a year. In Ontario, very similar, $38,727 to about $58,909. And of course, if you do end up doing overtime or you have another job, then this number does increase a bit. So I hope this answers some of the questions that you might have regarding applying to be a nurse, an RPN in Canada. I will be making 2 videos additional for RNs and NPs that include the same format. If you like this video, give it a like and subscribe to my channel. And this is Carlos from Army of Nurses. I'll see you next time, guys. Be safe and take care.